How do you put together a treatment plan, or do you put together a treatment plan for somebody? Because we were joking earlier that the myth about therapists is that they never tell you you're done, right? But what if you want to have a goal and a plan? Is that something that you work on with patients, or does that come from the patient? Is it patient directed?
I'm a big believer that it's patient-directed or client-directed.
Yeah.
So when somebody comes in wanting to work on a specific issue, that's going to be the treatment plan, is we're going to work on that specific issue and collaboratively decide when the time is to finish or take a break or end treatment. I'm a big believer that all of us, for our own emotional health and well-being, it's a lifelong journey, but therapy doesn't have to be a lifelong journey. So you can work with your therapist to decide what's right for you as far as timing and planning.
And then, like, how much time are we talking about?
It all
Weeks,
depends.
months, years?
Cognitive behavioral therapy is more of a short-term therapy. People come in for CBT, and it may be 6, 8, 10 weeks of work to get over a certain hurdle or obstacle or deal with a loss.
Like, what would be an example of somebody who would benefit from cognitive behavioral therapy?
Maybe someone who's feeling a lot of anxiety or just had a recent loss, or somebody who had a life event or a newly diagnosed illness. So I work with a lot of people who have physical illnesses that all of a sudden throw their emotional health into a bit of a tailspin. So if they're like just had a heart attack or diagnosed with diabetes or something that changes the course of their life, short-term 8 to 10, 15 weeks of cognitive behavioral therapy to help them manage this new diagnosis can be really helpful.
And what other types of therapy are there, like more intensive?
So there's traditional psychotherapy, like Freudian psychotherapy.
That's when you're on the couch.
Right. That's the cartoons will show you lying down on a couch, and I think traditional psychotherapists are still trained. You lie down on a couch. There's brain spotting, dialectical behavior therapy. There's a whole different range of different types of talk therapy that can be used, and a lot of therapists are trained in multiple modalities and will use what's the best fit with the person they're seeing at that time.
And will I know this as a client, or will you just sort of work your magic on me?
It kind of depends.
Yeah.
I'm a big believer in psychoeducation, which is teaching a lot of the way the brain works, teaching about the difference between what's happening. So for example, with a lot of neuroscience, we talk a lot about how the prefrontal cortex, our thinking part of our brain, and our amygdala, which is our fire alarm in our brain, how they work together when we find ourselves under stress or anxious or in crisis. And I'll do a lot of explaining and teaching about how that works. And the more information you know about how your brain works and the more tools that you have, the better off you'll be.